our next session with a great title, Maximizing Impact of Key Opinion Leaders. Together with us today, we have Mark Benthin and hopefully also Souhila from BMS. So we hope that you can also make it and join. Otherwise, it will be a nice fireside chat between myself and Mark. But first of all, Mark, how are you doing?
I'm doing very well. I haven't been able to get a better looking avatar, so I'm here live today. That is what it is.
Okay, fantastic. Thanks a lot, Mark. So first question, which I would like to discuss with you is how do you see the current role of key opinion leaders after COVID and their demand in engaging channels?
I think we have to. I mean, obviously the industry view may be slightly different, but what we have seen from our perspective is there's a huge increase in the demand for digital-based content and authentic original content, where you can hear material from the horse's mouth. And there's also been a massive push of acceptance of recorded material. So instead of just being able to see somebody live, then physicians are accepting to have conversations that are remote and have meetings and get recordings of meetings and things of that nature. So that combined with not only this, remote participation capability that was driven through the pandemic, but then also the improvement that we've seen to short form content. So a number of people that were in the mode of generating 30 minutes, 45 hour long conference series with a speaker are now generating very, very short question and answer that fit together into a nice 30 or 45-minute total experience if you went end to end, but are also able to, physicians are able to experience that content slice by slice as they need to, as they want to go deeper into the topic. So I think there's some trend lines that are both technological as well as just basic human behavior acceptance that have now driven this really a huge increase in the demand for the content, the different kinds of content that physicians can generate, the various sources from it. And I think that means that we have to, as an industry, we have to keep up. That means we have to make sure that there's a sufficient volume of content and that the content is readily accessible across any various channel that they would like to view in. There's a number of comments we receive from clients who have stated that some of their content traditionally would sort of sit on the shelf because it was only used in a few different ways. Well, now there's so many different ways that content can be deployed and used. It means that there's maybe a greater pull through for different key opinion leaders on different topics.
And so do you see the increase in that trend of reused content? Will this remain from your perspective and insights?
I think we have to. Everything, whether you apply it from a naming convention of modular content or not, the physicians should be able to judge. The receiving physician should be able to judge with their mouse clicks or their thumb taps as to what content they find to be valuable in a particular topic area, and they will, if they can participate in many different ways and see materials that are more reflective of the kinds of way they'd like to consume the content. So it's great topics with great speakers, but in a way also that they can consume it easily, then that demand will certainly be there. So it's very much this modular content paradigm. And there's many different ways to distribute that content. I think many companies are moving towards it down that road of thinking of other ways to get the content out there. But it's still surprising that we tend to think of it as more of a destination than as material that really should help the sales teams, the field teams, really engender better conversations. So I think it still has a ways to go. We've started. The trend is there, but there's still more work to be done to take advantage of the medium.
Thanks a lot, Mark. Next question. Nowadays, we even speak about a very interesting rising trend, which are the digital key opinion leaders, right? So do you see that Pharma as an organization already identifies them and interacts in a quality way with this new ACP TikTok generation?
Well, there's certainly different organizations have identified. I think Souhila will certainly have a
Hi,
comment
Sophia.
in this regard. Hi, Souhila,
I
and great to have you aboard. So the question about digital KOLs, certainly we see a number of people looking to identify who is the influencer online versus who might have been the influencer offline. At the end of the day, I think it's important to understand the sphere of influence, and it certainly does open up the door that there may be new influencers that can be more available or can be more solicited or successful online. But I think we're moving towards more of an omni-channel type of approach here with even the opinion leaders. If you're an opinion leader, you've likely now started to embrace the digital technology. So that separation between online and off, we're not a big believer in its long-term involvement. We think that an opinion leader will be an opinion leader and they will be a digital opinion leader at some point as well. It may take them a little bit more time to get there, but there's no reason why somebody who was successful offline will not also be successful online if the effort's been put into it. Souhila?
I agree. So Hila, really glad to welcome you here. Same question for you. We spoke about the importance of the digital key opinion leaders and how your organization, so at BMS, are currently dealing with that rising trend.
Yeah, no, thanks for the question, and sorry for my delay. I had some technical issues based on the link to the digital world where we're navigating. But I'm very pleased to be here and very pleased to be part of this interesting conversation with you, Mark and Dario. I will say I will take a step back, and I don't know where you started from, but this digital opinion leader need to be put in the context of the key opinion leaders we've been working with traditionally in the pharma company, right? So for what we categorize as key opinion leader in a pharmaceutical company are really related to the skills and the sphere of influence that any individuals can bring and how it match with the pharmaceutical company objectives overall, right? And most of them are identified, selected for this for what they can bring and how we can better partner with them. What I see from a digital opinion leader that we call now, and it's a very more recent term, like about less than 10 years roughly, they may not bring the same skill set, right? What we know is they are highly influencing using the social media space, right? So the approach we are taking is first and foremost to identify, to continue to work with our key opinion leaders, as we used to do, based on the work we need to collaborate with to really understand their unmet needs, develop very innovative medicine to bring back to the market and to get them to really influence and raise awareness of the value of these products. And this may or may not fit with the digital opinion leaders skill set, right? So we keep this main objective when we do think about KOL engagement and strategies. But absolutely, now we have these new digital opinion leaders in our space. And what we do in a company first is that we more recently started to invest in social media listening to first understand what's going on in this social media space and who are these digital opinion leaders and what they say. So really, we captured insightful information that we bring back to the organization that help us to shape our strategy. And on the other hand, we have recently tools to identify and mapping out who are the digital opinion leaders. But most importantly, we want to match that who are these digital opinion leaders who might be also KOLs. So when we engage with them, they will be not only partnering with us as part of the KOL engagement, but also amplify and leveraging the social media channel as part of that.
Thank you, Souhila. Very interesting, and absolutely, I think that companies who won't identify digital key opinion leaders will, in some aspect, fail on long term. Next question, how to deliver actually customer experience? The whole day we speak about customer experience to those particular key opinion leaders or digital key opinion leaders, and what are those channels which they currently demand most? Maybe we can remain with you, Souhila, and then move to Mark from the solution vendor side. vision.
Yeah, no, absolutely. I think we've seen an evolution in the key opinion leaders' expectation from the pre-COVID to the post-COVID era. Everyone has been able to shift from a more traditional channel communication to a digital space. Everyone has been able to really quickly react and leverage the digital space because we had to, right? Because of the pandemic constraints. What we have to understand is that we are in a new era post-COVID that will not anymore being what we experienced prior to COVID or during COVID. We have the choice, we have the options, and people get to be in highly involved and intensively leveraging the digital space. So I think, I'm not an expert in identifying which is the best channel, but I can tell you, and I'm sure Mark can bring this from his expertise, but I can tell you is the most important is really understand and tailor the channel for each one of our KOLs. And there are different segments of KOLs that can be influenced by their different parameters, such as the specialty where they're working for, the countries where they are exercising, the generation they belongs to, and how they are savvy or not for digital space. So I think everything will be related to the right balance to tailor this customer experience and to address their needs. And I had a great conversation with Dario a few days ago about the fact that when we speak about customer experience, it should be the same as what we're looking for as us, as regular customers, right? Our KOLs evolve. Our KOLs have a new expectation. And this is where pharma needs to continue to evolve to further align, understand their expectation, and match with their expectation in terms of customer experience.
That's very interesting, especially matching the expectations, because at the end of the day, this is the hardest part, right?
Exactly.
Mark?
Well, I think those are some great comments. And obviously, from a solution vendor perspective, we've been focusing a lot on what we think is kind of a core capability that touches a number of different customer experiences, everything to do with personalization and personalized video and lifelike avatars, and being able to leverage that. And as we look at the key opinion leader audience, that's really an area where we think that they can all arrive with whichever skill set that they currently have. Some may be social media influencers already, but many are not yet. And so what we've been essentially trying to package for the KOL side of the house is really an ability to help them reach new audiences across new languages, which is always important, both for their eventual pharmaceutical sponsors, but also for their role themselves, be able to really simplify the execution. There's many things that, from a capability perspective, if they're done in a straightforward manner with today's technologies, that the KOL can look like a star overnight without having to have, really thought of any of the technical reasons behind that. And then I think the third key thing is we can really help them and really should focus on helping them make it easy. So optimizing their time and the distribution that they can achieve. Those are the ways that we think that technology, or the new era of technology, can really help the KOLs become DOLs, so that everybody is just OL, right?
Yeah.
That's
And I join absolutely Mark in that point. And that's let's reflect back on what I was the distinction I had with between DOL and QOLs, right? The digital opinion leaders can be people that having a very great influence, but they may not be fitting with our connection, the people we've been identified, the type of KOL we've been working. But we have truly an opportunity to help the real KOL, the KOL we identified as such, to really more comfortable and leverage the social media to continue to amplify their voice, because they are unbiased, trusted voice, and that's the most important for us in the pharmaceutical company. We want to make sure that people's understand the value of the products, with in an unbiased manner and being communicate that way. And that's where this is an opportunity exactly for KOL. The second aspect that I joined Mark from a customer experience that remains the same is that we always looking for not bombard these KOLs for tons of information, duplicate this information, duplicate this point of contact, and that's where I think the omni-channel may bring a lot of opportunities really to simplify this approach and making sure that this match with the expectation they're having in terms of communication and partnership.
Absolutely. Well, from my experience, I would say that with all key opinion leaders or opinion leaders with whom you have a great relationship, you have it most probably because of this H2H relationship, right? Connection. But how actually technology and what role technology plays in that particular funnel? And how do you see, for instance, that this will evolve, especially taking into account that we are having an upcoming digital key opinion leaders? Who would like to go first?
Mark, so we'll start.
Super. Thanks, Souhila. I think also we talked about catering to the key opinion leaders from enablement perspective, so they're able to participate in the online channels well. But a lot of that, it also comes down to that distribution element. And I think the distribution element kind of ties things together. So we're able to, whether it's through bite-sized chunks, which then are delivered across different mechanisms, different approaches, whether it's email or across web properties or Congress or whatnot, that serve that most important word of amplify that Souhila mentioned. I think that's where the rubber hits the road. And there's new methods of doing those things that are actually quite easy, that tie into all of the infrastructure that's already there, but just take advantage of this nuance of it's a key opinion leader, it's approved video, it's material that physicians will want to see in a certain way, in a certain context, and being able to distribute that capability effectively across the channel. So I think we're at a moment where it actually is a great time to look at this situation as we move into 2023. The core channels are now accepted. The movement to digital on the medical side is already there, but a lot of the expertise of implementation may not be fully there in all cases. So now's the time where we can really leapfrog and really help accelerate that transformation or that transition, so that the content that the KOLs actually have can reach the destination, the other physicians, in a very important manner much more quickly. And I think that's fantastic. We did something with a key opinion leader recently, and at the end of it, he was able to speak other languages that he didn't already speak, including Chinese, Italian, Dutch, and whatnot. And for him, it was fantastic, because then he was able to look at this scenario as reaching other physicians in other places, so that his research that he's continually busy with will find the right kind of destination, the right kind of home. So even that element is I think all about that amplification and distribution.
Absolutely. Thanks a lot, Mark. Souhila?
No, absolutely. I think we are truly in a real transformation, and this transformation is we've been embarked since many years now. I feel like pharmaceutical companies still late in terms of advancement of leveraging these digital spurs if we compare to others special fields. And the most important is really to partner with experts like Mark and other companies who can help us to understand which tools we can leverage to address the needs of these KOLs, how we evolve in this space. And really, I think the goal is, in terms of customer experience, to make it simple, right? We often make over-engineering everything we do, because pharmaceutical companies are scientist-based. And so that's something important. Even now, when we look at surveys, they feel overwhelmed with this digital, with this information that comes from everywhere. And so if we have an effort to do is really to digest this information, to give them the right materials, the right content that tailor the needs and that can leverage as well with their healthcare community, their followers, and so on and so forth. So a lot of tailors, personalization is required, and a really deep understanding of the environment where we are navigating to really address their needs.
Thank you, Souhila. With that said, I would like to thank you for this great conversation. We will also publish it on our YouTube channel, as you all know. So once again, thanks a lot to Souhila and Mark, and looking for the next one.
Thank you.
Thank
Very
you.
pleased to be part of this discussion. Bye.
Bye-bye.
Bye-bye.